We're turning back the tide of all of the rules and regulations that were put in place previously that decrease choices, that increase costs, all of those things. If you look at it in its totality, and nobody's looking at it in its totality, we will bring down premiums, we'll increase coverage, we'll increase choices, and I believe we'll increase the quality of care provided in this nation.
Republican officials flooded the airwaves this morning with basically this message: Obamacare must be repealed. And don't worry, the GOP is on it. But after a week of a week in which Senate Majority Leader Mitch McConnell had to pull his health care bill, then set a Friday deadline for a revised bill, which is now passed with no compromise in sight. And when he's even faced calls from the tweeter-in-chief to adopt an unworkable and unwise repeal now and replace at some point later in the future strategy, what Republicans might be feeling is closer to what McConnell told reporters on Friday. Quote, "It's not easy making America great, is it?" Wah, wah. Joining me now, Tara Dowdell, political marketing consultant, Perry Bacon Jr., senior political writer at 538, Van Newkirk, staff writer at The Atlantic, and Jamal Simmons, Democratic strategist. So first, let's reestablish for the panel here where we are in terms of the majority of Americans' views on the health care bill. 45% oppose the bill in the latest poll. 40% say they don't know enough about the bill to make a decision. 12% support the bill. So we'll put that up in a minute. But that is just to reestablish the baseline. There it is, that most people do not support the bill. I think it's is that a Monmouth poll? I can't read it that far away. But yeah, I think it's a Monmouth poll. So that is where we are with the bill. And I'm going to go to you first on this, Perry Bacon Jr. This is the latest sales pitch that's being made for the people whose marquee is repeal Obamacare and replace it with Trump care. Repeal Obamacare. This is what White House aide Mark Short has said. And this is, I think, what he said on Friday, that repeal and replace can actually be bipartisan. He said it today, that repeal and replace can be bipartisan. Take a listen.
If the replacement part is too difficult for Republicans to come together, then let's go back and take care of the first step in repeal. And even those 49, there's another member, Todd Young from Indiana, who, when he was in the House, voted for the bill too. So you have 50 members on record having voted for that recently. So that's an option. And then at that point, if you've repealed it, you can come back with a replacement effort that could be more bipartisan.
Having followed the health care saga from beginning to end, Perry, does that make any sense to you that somehow Democrats would get on board with a full repeal of Obamacare, followed by a replacement determined by the 50 Republicans that control the votes in the Senate?
What they're really laying out is you have a repeal, and then you basically have like a ticking clock where in 2 years or in 1 year, all of Obamacare goes away. So it's a big, basically like a sort of a debt ceiling threat, and then you bring Democrats to the table that way. It's odd because in December, Paul Ryan proposed this very tactic, and Donald Trump said, no, that's a bad idea. That seems unpopular. Let's not do it that way. So Paul Ryan dropped the idea. So it was a very odd, I thought, on Friday for Donald Trump to say, never mind, let's try this repeal. This repeal and delay idea will be probably even more unpopular than the actual bill. So I'm not sure why we're still talking about it. Yeah. But yes, that's what the idea is here.
And it's interesting that they're still selling it, Jamal, because McConnell seemed to rule that out on Friday, that was not going to happen. And not only was not that going to happen, he's already ruled out working with Democrats in bipartisanship, except as an emergency, like pull pin in case of emergency measure. This is Mitch McConnell back in February on working with Democrats at the time that they were in full repeal mode.
Well, it's clear that in the early months, it's going to be a Republicans-only exercise. We don't expect any Democratic cooperation on the replacement of Obamacare. We don't expect any Democratic cooperation on tax reform. Either Republicans will agree and change the status quo, or the markets will continue to collapse, and we'll have to sit down with Senator Schumer.
Okay, just to stipulate before I throw it to you, Jamal, the markets are not in collapse.
Right.
The individual market is having problems in about 38 counties because Republicans won't promise to fund the subsidies that pay for people's insurance. So Republicans are killing the market for individual insurance buyers. The market is not in collapse. Just remember that, viewers, the market is not in collapse, no matter how many times a Republican says it to you. Your witness, Jamal Simmons, is that a reality that is eventually, if Republicans continue to refuse to fund the markets, then they really will collapse because of what Republicans are doing, and they'll have no choice but to go to Democrats and say, let's go and do a bailout of the insurance industry?
They will have no choice but to go to Democrats because at the end of the day, the president and the Republicans are in charge of everything in Washington. The American people don't pay a lot of attention to this, but they know who's in charge. And so if something goes wrong, you tend to go to the person who's in charge to try to fix it. And if they don't fix it, they'll be in even bigger trouble. The problem with what McConnell's approach is now is, or Trump's approach, which is saying, oh, well, let's repeal it now and then we'll deal with the replace later, is who trusts that that will happen?
Right.
It just won't happen.
Nobody that trusts that'll happen. I don't think anybody believes they'll be happy they repealed it, and that will be the end of the story. Tara,
right. The repeal will happen. People won't have health care, and then we'll all still be sitting around figuring it out.
Free market. The free market will be working, and people not having insurance will be the free market. They'll be choosing to be uninsured, according to Republican thinkers. Tara, on this issue of bipartisanship, I just want to do one more bite on it, because Tom Price, who is the Health and Human Services Secretary, who is attempting to sell this idea that, not having insurance doesn't mean you that does not mean you don't get health care. He's been floating these sort of vague ideas about health care for a long time, including back when President Obama talked to Republicans about what he wanted to do. This is in 2010. This is the president going before Republican members of Congress to have an interlocution about health care. And Tom Price asked him a question. Take a listen.
You can't structure a bill where suddenly 30 million people have coverage and it costs nothing.
And I understand that we're not interested in debating this bill, but what should we tell our constituents who know that we've offered these solutions and yet hear from the administration that we have offered nothing?
I'm using this as a specific example, so let me answer your question. You asked a question, I want to answer it. It's not enough if you say, for example, that we've offered a health care plan, and I look up, this is just under the section that you've just provided me, or the book that you've just provided me. Summary of GOP health care reform bill. The GOP plan will lower health care premiums for American families and small businesses, addressing America's #1 priority for health reform. I mean, that's an idea that we all embrace. But specifically, it's got to work.
Tara, their idea at the time was lower premiums.
Right.
And then I mean, the idea of these two parties who are at these polls being able to even negotiate anything, do you think that that is realistic?
Well, first, let me just point out something very obvious here. That bite that you just played tells the entire story. Why is there no bite like that now? Because it does not exist. Because Democrats have not been included in the process.
Right.
That bite shows that President Obama and Democrats included Republicans in the process. Republicans opted to instead attack what the president was trying to do and attack the legislation and sabotage the legislation, but they had every opportunity. And guess what? That bite,
right.
There are tons of other ones just like that because Republicans were included in the process and chose not to participate.
And so was the public. I mean, town hall after town hall, even the president holding town halls, explaining the health care bill, 161 amendments. And I don't know if these are all Republican amendments, but we know that more than 100 Republican amendments included in a bill that then those same Republicans who offered those amendments did not vote for the bill. So they offered amendments. Their amendments were considered, in some cases, included in the bill, and they still didn't vote for it. Van Newkirk, I want to bring you into this discussion because one of the reasons we wanted to talk to you and pinched you from Politics Nation this morning, where you were great this morning, by the way, was that you wrote a really fascinating take on why it's so hard for this country to come to an agreement on having universal health care. And it is a take I had not read anywhere else, and even sort of the link to Dr. King's fights for civil rights. Can you just summarize that for us?
Yeah, so what I wrote about there was how the history of healthcare in America is intricately linked to civil rights. So the reason why our system is the way it is, a private-based system that doesn't cover everybody, and especially as the rest of the world moves more and more toward universal health care, is because think about the last century of American politics. Would that system of universal care really have worked with, say, Jim Crow America? And I think public health officials, almost to a person, say no. And so what I wrote about there was how the voices for universal health care that led to the Medicare and Medicaid, that led to Obamacare eventually, they all came out of the civil rights movement. They came out of black activism and also progressive activism that recognized that the only way America could erase, say, its health disparities, its racial inequalities, was with a broad health safety net. And so you look at the response to Obamacare, you look at sort of over the last 50 years, the response against Medicaid. Those have all had some sort of racial animus and component to them. So it's a push and pull, a back and forth over the last 50 years.
Yeah, and it is, fascinating, Jamal, that you did have this, Rush Limbaugh originally calling Obamacare reparations, right? So there's been a very barely coded resistance to expansion of Medicaid that has exactly what Van is discussing, that kind of tinge to it.
That's right, and you think about the reaction to public education in the South after the desegregation of schools, and where Southerners, white Southerners, were willing to take their children out of school to keep them from having to go to school with black people, or create these academies, these separate sort of economically advantaged, academies for white children to go to. And so you see this divergence of, do we take care of everyone, or do we just take care of those who are enfranchised and well looked upon? And I think this is incredibly important.
And I want to really quickly play a sort of change just in one person. This is Mitch McConnell back in 1990, his re-election ad, touting the need to cover all Kentuckians with health care. Take a listen.
When I was a child and my dad was in World War II, I got polio. I recovered, but my family almost went broke. Today, too many families can't get decent, affordable health care. That's why I've introduced a bill to make sure health care is available to all Kentucky families, hold down skyrocketing costs, and provide long-term care.
And this is Mitch McConnell on Friday saying that coverage is not care. Take a listen.
Coverage is not the same as care. If you think coverage is the most important thing, I can see why a single-payer system would be attractive to you. But coverage doesn't equal care.
So, Van, how do you frame that change?
It's an interesting change. I think most people in health policy will tell you the only way to get people care is with coverage. It seems to be a pretty obvious conclusion there. But, I think it's different when you're talking about, when you're beholden directly to, the people of your state, when you're talking about a state that doesn't have a lot of the same demographic challenges as, say, expanding in Texas. Things got a little bit different over the last 20 years or so.
Yeah.
And yeah, it's just interesting watching the flip-flop here.
And they got different exactly the way you think. Perry Bacon Jr., a Kentucky native on the panel, as fate would have it. How do you frame that change, just in the way Mitch McConnell and the way Kentucky has reacted to the idea of universal health care?
My sense is that if you think about, this is a health care bill that was basically written by Mitt Romney, it was expanded in the state of Massachusetts by Mitt Romney nationally. So Republicans are not really passing, because universal health care became a Democratic thing, Obama did it. Now we're seeing basically a health care bill that's not really a health care bill. It's really a bill that rolls back the welfare state. It's really a bill that has tax cuts. And if you think about the Planned Parenthood, it's a bill to really try to cut down on abortions. Those are the three ideas: anti-tax, anti-abortion, anti-welfare. This is not a health care bill. It achieves other Republican goals, but not really health care. And that's why McConnell is, I think, accurately downplaying the kind of health care achievements in the bill, because it won't really have any.
Yeah, and Terry, you're not.
Joy, just really quickly, this is incredibly important to remember what Perry just said. The healthcare marketplace was a conservative idea that started in the Heritage Foundation, made its way to Massachusetts. And remember, nobody actually has a card that says Obamacare. Right. You have the healthcare marketplace advertises private insurance for Americans to get. It's incredibly important to remember.
Yeah, absolutely. Tara, last word.
I think an important point that needs to be made, and people, I want to emphasize that, I say it all the time, the Affordable Care Act is designed to improve the quality of health care that people receive. A lot of that was done through the Department of Health that Tom Price now runs, but much of that was done through regulation, through various different regulatory processes. And so I think that people forget that, yes, there is this side that is designed to provide financial support for people to purchase care, but there's a whole other side of the bill that is specifically designed to improve outcomes, which in this country, considering that we're a developed nation, we do not have the best outcomes. outcomes. We have the most infant mortality of any developed country. And so that the Affordable Care Act is targeting those things. And Democrats need to continue to also emphasize that when they talk about it. That's the other side, and that's the most important side.
Yeah, and it was even higher before we had broad-based health care, things like Medicare and Medicaid. Our infant mortality rate and our elderly survivable rate were even worse. Hello. This seems pretty obvious.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.